Hey there, and thank you for joining us on today's webinar, Delivering a Modern, Consistent Registration Experience Across Your Enterprise. My name is Lance Dunn, an Associate Director of Client Solutions at Phreesia, and I'll be moderating today's presentation. Today, we're going to be discussing how LifeBridge Health has simplified its patient experience and standardized registration to collect patient information accurately and completely across locations. Before we get started, I would like to quickly share some housekeeping notes. Attendees can submit questions at any time using the Q&A widget at the top left-hand corner of your screen, and I will ask as many questions as our time allows. In the resource widget on the left-hand side of your screen, you'll find a one-page overview of Phreesia, a link to a blog post about vendor consolidation, and a white paper about how to become the go-to destination for care in your community. If you have any technical difficulties, please click on the Help widget. It has a question mark icon and covers common issues. Since it's always one of the most frequently asked questions, this session will be recorded and you will receive a link by the end of the week. We'll be starting our presentation today with introductions of our panelists and Phreesia. We'll follow that with a discussion of the challenges that arise when the patient experience is inconsistent between care locations within a healthcare organization. We'll discuss the importance of using digital tools for registration and standardizing those tools across an enterprise organization. And we'll spend the remainder and the majority of our time talking to our guest about how his specific health system is doing just that. Speaking of our guest, I'm thrilled to introduce Joseph Koons, Senior Vice President and Chief Revenue Officer at LifeBridge Health. In
Thank
this
you.
role, no worries, Joe. In this role, Joe is responsible for LifeBridge's revenue cycle functions for both the hospital and medical group lines of business. He is a certified revenue cycle executive and professional coder, a fellow of the Healthcare Financial Management Association, and has worked in healthcare revenue cycle for nearly 25 years. And now, just a few brief words about Phreesia. Phreesia is guided by our mission of creating a better, more engaging healthcare experience for patients, providers, and staff. At over 120 million patient visits annually, over 1 in 10 visits across the US, our digital platform helps healthcare organizations enhance the patient experience, drive efficiency, and improve healthcare outcomes. We have real-time integrations with all the leading EHRs and registration, scheduling, and billing systems. We're a publicly traded company on the New York Stock Exchange, and we've been rated #1 in patient intake management by the research and insights firm KLAS 4 years in a row. Our security and privacy efforts are recognized with the industry's top certifications. We have 18 plus years of expertise helping consolidate and streamline the registration experience across health systems and enterprise organizations with workflows that are also customized to various specialties and care settings. If at any point during this webinar you have questions about what we're discussing today, or you're just interested in learning more about how we help organizations of all sizes, you can request a consultation using the drop-down on the right-hand side of your screen, or visit Phreesia.com. I want to start by talking through what some of you may be extremely familiar with, the challenges that come when the patient experience is inconsistent or disjointed across the enterprise. It can first lead to higher vendor costs because an organization is paying for multiple solutions and in turn, more relationship management and training costs. Operations become less efficient because processes are not standardized and data is not flowing between locations, which results in not every facility being optimized for success and staff having to do repetitive work. Data also is caused to be inaccurate or incomplete because patients are not entering the same information at every location, which can lead to claim denials and other errors. Volume is created to be disproportionate across that organization because patients prefer certain locations that have a better, more convenient experience. And lastly, and most notably, patients are dissatisfied because they're being asked to complete duplicative forms and take part in redundant, often repetitive processes. So let's tap into those repetitive processes for a moment because it can be a huge point of dissatisfaction. Patients don't want to fill out the same information more than once, especially if they recently interacted with your organization. Unfortunately, 83% of patients said that last year they found themselves filling out the same information or duplicate forms at every appointment. This was according to a survey by Carta Healthcare. 42% of patients spent 6 minutes or more recounting past medical history, and nearly 75% of patients reported completing more than 2 duplicate forms. This is a very unfortunate experience for patients, and it comes at a huge risk. 1 in 5 patients said having to repeat forms at a doctor's office makes them less likely to return to that office. This could be a bad experience at a single provider location that lacks a digital solution for registration, or it could be the experience across locations within a single organization that has disparate processes for data collection. Either way, it's not ideal and it's preventable. Solving for these issues starts with presenting a consistent digital front door across your health system. Your digital front door is made up of technologies that facilitate the patient journey before, during, and after an episode of care, many of which you can see on this slide. That could be everything from scheduling to registration and payments to post-visit surveys and patient recall or educational outreach. For your digital front door to be consistent, branding should be aligned across your locations, and patients should be getting the same great digital experience wherever they go within your organization. Now, I want to be clear, just because we're standardizing registration doesn't mean that we can't customize intake for every patient or serve the unique needs of certain locations. For example, patients that are visiting an OB/GYN office need to answer certain questions that an ENT office do not. Or a physical therapy location may need to administer certain consents that other offices do not. These aspects are obviously important. But what this does mean is that there is a standard baseline set of data fields that every location is collecting, and that data travels with patients across your enterprise so that they don't have to fill out the same form twice, and they can check in, pay, and schedule appointments promptly and easily. But why is that important? It's important because a positive experience with your patient access department plays a critical role in retention. We saw in the data earlier in this presentation that it can be the difference between them seeking care at your health system or leaving for your competitor. When your organization's patient experience is digital first and standardized, you're consistently providing the experience patients expect and more likely to continue to earn their loyalty and trust. Standardized automated registration workflows also reduce the burden on staff, require less staff, and make it easier to centralize certain patient access functions across your organization. Plus, when we leverage the registration process to collect payments from patients prior to visits across locations, we're able to accelerate that revenue and see a more consistent cash flow across the enterprise. And then finally, when every location is collecting accurate and complete data about patients, it saves your clinicians time and gives them the information they need to ultimately have a more meaningful, efficient conversation with all of their patients. Sorry, you've heard a lot about how we're able to do this, but let's jump into how Joe accomplishes this every day with LifeBridge. Audience, we got some questions that have already started to come in. We're going to start with a few that we've already prepared for Joe, but we're looking forward to hearing from your questions from him. So please send them in and we'll get to as many of them as we have time for. So Joe, let's have you start by sharing a little bit about LifeBridge Health, its facilities, and the patients that you serve.
Sure. Thank you, Lance, and thank you for inviting me on this webinar. So LifeBridge Health dates back to 1866, so over 150 years of rich history, starting as a 10-bed hospital focusing on patients and people, community in which we serve. We've grown since then tremendously to an organization that employs over 13,000 employees with 5 hospitals and 1,947 beds. The medical group, we do have a large medical group that comprises of nearly 700 employed physicians in and around Baltimore, with a total combined net revenue impact of $2 billion. Our motto is to care bravely, and that means that we are going to take care of our patients, even though sometimes it's difficult and it's hard, but we're going to do that. We're going to put our patients first above all else, and be there for them. From a payer mix standpoint, I know listeners may be interested. What is your payer mix? We are comprised of about 50% Medicare and Medicare Advantage, 21% Medicaid and NCO, 26 commercial, and about 1% self-pay.
Great. Yeah, you have a really impressive organization, and thanks for giving us the history, not only on how you all have existed, but also how your patient population comprises today. So as we transition into learning about your registration process, can you let us know how LifeBridge's registration process has changed over the past several years as you've started to introduce technology?
Sure. Yeah. So registration in general has evolved and has gotten far more complex and detailed, and to the point where it impacts the quality of care or quality measures. The information that's gathered is critical for the patient treatment plan, et cetera. We all know that. So accuracy is of the utmost importance. And as time has gone by and registration has evolved, it's no longer about just gathering information. It's getting correct data, accurate and prompt data from the patient every time and consistently every time. And to meet that end, we've introduced technology to focus on registration accuracy that checks within all of the registration fields for conflicts of data, looks within the insurance verification message eligibility, and verifies that against the information collected from the patient. So it alerts our registration staff that potentially there's an error that they need to correct before the patient leaves. So that focus on accuracy is very important. And then from a compliance standpoint, regulations have increased. We're now looking at the No Surprises Billing Act, along with a number of required forms and financial assistance, price estimation. I go on and on and on, but a lot of those regulations require that we obtain acknowledgments in forms from the patient and retain that information in our record so that we can prove to different agencies that we've complied with the rules and requirements. So those three are really critical, and they all have evolved over time and have gotten more important and more complex as it relates to registration, intake, or scheduling.
Yeah, all of that 100% understand, and that's what we see across the industry. I think one of the things that we talked about within our slides that before our Q&A was around the consistent registration process across locations. So why is it important to you and your organization to have not only the accuracy, compliance, those elements that you talked about, but also consistency across locations?
Yeah, consistency is critical. It's critical to our staff in that onboarding new employees, we can train them using standard content and information. We can apply our training program consistently so that we get to the level of quality and accuracy needed to get claims paid and to provide that information to our clinical teams. So from a training onboarding standpoint, it's critically important. It's critically important for patient experience and the patient satisfaction, because patients, we've heard from our patients through surveys, through feedback, that they get frustrated, and they get annoyed when they have to provide information and that information is different than what was requested previously. So having that level of consistency provides for the same look and feel experience to our patients, so they know what to expect and they know what information that's going to be requested. And preferably, if we obtain that information one time, there are certain data points that is applicable for future visits that we don't have to re-ask the patient. And that's another patient satisfier, is that patients don't have to provide that information over and over and over again. And then, of course, we keep talking about accuracy, but if we have if we have the data standardized and what information that we're gathering, we can build technology and rules against that information, so that we can alert our staff on the front end when they do make mistakes, because mistakes will happen if it's entered by our employees or even by patients. So we need to have that level of scrutiny and rigor and be behind the registration to ensure that level of accuracy, so that we can get paid for the services and the hard work that our caregivers provide.
Yeah, definitely. One of the elements that you talked about a lot within that response was around patients and getting their feelings around inconsistent processes or kind of what things may have looked like years ago. As you've started to implement more digital solutions, how have patients responded? Have you seen an increase in that patient satisfaction and retention?
Surprisingly, absolutely tremendous response. And when we first introduced, or we were evaluating a digital application such as Phreesia, our concern was whether or not our community, our patients, would embrace it, whether or not they would have a smart device that they could use to complete the registration. We were really concerned about the utilization rate. How often would they really use this application? And what we found out from our go live since February of this year is that our utilization rate has been surprisingly high. It's been almost 70% across 173 locations. We implemented Phreesia now in all of our medical group clinic site locations. And part of the workflow in Phreesia is a satisfaction survey, and it asks patients how satisfied were they with their pre-registration experience. And so far since February, we're running consistently around 93, 94% in the good or excellent range. So we are hearing from our patients that they like this. They like being able to complete the information at their convenience, consistently, when they want it, and in advance of their appointment. So yes, we've seen a tremendous response from our patients.
Yeah, it's actually, I think the group was really interested in your response now. We actually have a question that just came in. They said that they have trouble getting multiple stakeholders across our enterprise to align with technology and overall strategy. How are you and your team getting staff on board and allowing for customization by location?
So that's always a challenge in a large health system with many competing priorities, and when implementing a solution, not only for the medical group but in the hospitals as well, it can be a real challenge. And so the first thing that we set out to do was to really answer the question of why. Why are we doing this? So that the patient access, the registration staff, the medical staff, the physicians, our caregivers, nurses, they would know why we're doing this. And first and foremost, we're doing this, and we've implemented Phreesia for the patient experience, so that we place the information in the patient's hands. They can complete the pre-registration themselves prior to the appointment, including forms, presentation of forms, signature of forms, acknowledgement, clinical screeners, where we have now completed, or not us, but our patients have completed in advance of their appointment, well over 21,000 clinical screeners since February. So, and we were able to take the information from the clinical screeners and import those in discrete fields in our EHR. And so that helps our caregivers tremendously. Plus, we're able to report on those data elements. Clinical screeners, for those listeners, that's also referred to as social medical history forms. So we call them clinical screeners. So that has been a tremendous success. And that's another why, being able to obtain the information from the patients that's important to their visit, and get that information consistently and promptly to the caregiver so that they can act upon that information in advance or during the appointment itself. So focusing on that why has built the buy-in that's needed, and then continually communicating to all levels of the organization as to what Phreesia is, what it does, and most importantly, how it will impact our patients and improve patient satisfaction.
Yeah, and I mean, certainly to build off of the clinical reports, not only are we getting that more accurate response, but also the quality reports, the supporting of providers that we're able to have for more of that private conversation, I think is something that your group has certainly seen. I think to build off of a little bit more on the more accurate self-service registration information, you mentioned a stat on clinical and social screenings to help with um, more of the clinician side of the business. But in terms of accuracy of that information, that's more kind of contact or demographic information. What results have you seen there, and why is that important?
Yeah, again, surprising results, in fact, and the numbers speak for themselves. So we have, since February, have obtained over 15,000 emails from patients, and we've obtained nearly 3,000 telephone numbers, well over 1,300 addresses have been updated, in addition to over 5,000 cards on file. So interesting here is that the patients are updating the information more frequently than they would have if they presented in person. And we know that because from our copay collection percentage, so patients that complete the Phreesia application, they get to the very end and it presents them with the estimate and an option to pay. If the patient goes ahead and pays for that visit, that's a copay collection. And we compare that percentage against those patients that did not use Phreesia and instead used the manual process where a registration or a patient access rep completed the registration manually. And when we compare the two percentages, the Phreesia copay collection percentage is much higher, well north of 80%, compared to 54% if done manually without Phreesia. So patients are definitely gravitating to this application. They're completing the information consistently and updating their information at a higher frequency compared to if they were to manually register the patient in front of them. So very interesting results. We're excited to grow on those percentages.
Yeah, one of the areas, kind of to go a little bit deeper into collections, is I know your organization implemented card on file and the ability for patients to be able to put card on file. And I know, talking about a consistent experience, patients are able to put that card on file across the entire organization. So Can you speak to how that is starting to, that really influence your all decision, both in the patient satisfaction as well as obviously increasing the collections?
Well, the card on file option is a convenience factor for our patients. It is also a value proposition for the organization where if we're able to collect the copay amount or the estimated amount due, then we're no longer that necessary to send a paper statement via mail or email. And it also reduces the volume of telephone calls back into customer service. So it increases the level of efficiency in collecting that copay. And then from a patient standpoint, they no longer have to re-enter that information again. So when they come back and they see their primary care physician or the cardiologist, that information is already saved in the application securely, and they can go ahead and process and pay that copay easily at that time. So, and the information too, within the application, there's an ability to set or configure the different data requirements based on location, patient type, medical service. So we have the flexibility in presenting the information such as forms, because forms are different in the hospital than they are in the medical group location. We can set all that differently based on the location, the patient type, the medical service. So lots of flexibility. The patient sees the information the same time, so it's consistent. And many times, if the patient was seen previously, that information is pulled forward and presented to the patient so they don't have to re-enter that. Now, that is a decision, a configuration that's made for each of the locations where we don't have to present or pull that information forward if we don't feel comfortable in certain locations. We're not comfortable if after 90 days or 120 days pulling that information forward, we'd rather have the patient complete it. So that lots of flexibility, getting back to the consistency and the accuracy.
Yeah, 100%. I think, we kind of talked about we want to create that standardization across locations, but also tap into the individual needs of the location or the care setting. And I think what you just hit on, Joe, is exactly, your team and your organization has done that pretty great. So that way we're getting the requirements and we're standardizing while also speaking to needs of groups, maybe like oncology or therapy appointments that may have patients coming in several times in a month, to not have to represent that, but maybe across the entire organization, we allow for more of that standardization. So that's great. I think the closing question I would have for you is if you could offer one piece of advice to health systems that potentially are on the webinar that are at the start of a journey like yours, what would that piece of advice be?
Communicate broadly, often, and focus on the why. Why are you doing this? We're doing it for the patient to improve the patient experience. And so I would recommend that when rolling this out across the organization, is that you sit down and you listen to the different areas and what their needs are and what type of patients that they see, and then respond as to the reason why we're moving or evaluating an application such as Phreesia. And knowing that there's flexibility based on location, patient type, as to what information that can be collected and how often is the information collected, what forms to be presented, all adds to that consistency, the accuracy, and making it easier for our patients and not having to re-enter information over and over and over again, because we've heard many times that our patients get frustrated when they are seen one day at a primary care office where they provide their information and they come back the next day to the cardiologist and they have to provide the same information again within the same health system. So Phreesia solves for that. And many times, depending on that configuration, the patient doesn't have to re-enter the information again. So I would say focus on the why, communicate often, and listen and address the specific needs of the locations and the areas in the health system.
Great, great. Well, with all of that being said, that is all the time we have today. If we didn't get to your question in the chat, or if you have any questions about Phreesia, please do not hesitate to request a consultation using the form on the right-hand side of your screen. We would love to be in touch. Thanks, Joe, again for joining us. You have such great insights, and your organization has certainly thrived under your leadership. So just want to say thank you again.
Thank you.
And of course, thank you. Yeah, thank you to the audience as well, everyone that was able to join us today. Have a great day.